The Executive Director of the National Public Health Agency, Professor Foday Sahr, has said that ongoing investigation of a suspected case of viral hemorrhagic fever, or VHF, is a normal routine. The country's top public health authority addressed the media in a press conference on Monday, 2 days after news of the death of a health worker sparked fears of outbreak of a viral hemorrhagic fever disease. The deceased, identified as a 29-year-old female health worker, fell ill while working in a public health facility in the Eastern Connaught district, according to authorities. Initial reports shared on social media suggested that she displayed VHF symptoms, but Professor Sahr said the only symptoms she exhibited were common to diseases they deal with daily. An important symptom of VHF is bleeding, and the deceased didn't show that, he noted.
The patient, we have the head of case management here, the patient bleeding. There was no case of bleeding. We all had experiences during the Ebola, So it's nothing like that. This patient there with fever, body aches, and maybe slight diarrhea or whatever, That is it.
The Public Health Agency had said it deployed a surveillance team in Connaught immediately it received the report. Test results from samples from the deceased were declared on Sunday as indeterminate, which means it's inconclusive, and laboratory technicians attributed this to the chemical formalin which the body had been preserved with. The deceased was tested for all 8 different VHFs that are part of reportable diseases in Sierra Leone, according to Doris Harding, head of the Central Public Health Lab. A total of 303 people the deceased interacted with between Connaught and Freetown were identified and subjected to observation. Public health authorities say they are now relying entirely on the outcome of these observations. Already, some of these contacts have gone a maximum of 19 days as at Monday, 2nd December, without symptoms, and the highest incubation period for a VHF disease is 21 days. Nonetheless, the Public Health Agency said it has activated all necessary response protocols to mitigate any potential risk, and officials say they are taking all internationally stipulated measures until they rule out VHF. The issue is reported to have ignited interest internationally, including Sierra Leone's neighbor, Liberia, which is said to have heightened its surveillance in response to the situation.